Hi, I'm Kylie. I'll be your nurse today.
Hi Kylie, I'm Callie. How are you?
Good, how are you?
I'm great, thank you for asking.
So what brings you in today?
I actually just twisted my ankle at work, so I need to get a physical.
Okay, so before we do that, I have a couple questions for you. So what is your full name?
Callie Gruen,
Okay, when is your date of birth?
10/22/1996.
And were you born in Cincinnati, Ohio?
Yes.
Okay, so you're 23,
Yeah.
and does the gender you identify as, does it match the one that you were born with biologically?
Yes, it's female.
Okay, and what is the race that you identify as?
White.
Okay, and then what is your religion
Catholic.
and your marital status?
Single.
And you said you fell at work, so where do you work?
I work at JCPenney as a merchandise assistant.
Okay, and what is your address?
8680 Susan View Lane.
And what is a good number to reach you by?
513-519-2221.
Okay, okay. And what is your email?
Just my full name at gmail.com.
Okay. And do you have any known allergies?
No, not at all.
Okay, so for an emergency contact, who do you use?
My mom, Peggy Williams.
Okay. And what is her contact number?
513-505-1624.
Okay. And is there any other number that she goes?
No other number she has.
Okay. And before we talk about the chief complaint and stuff about your ankle, we'll go to the next page to finish out these questions. So for your present health status, are you on any medications?
No.
Okay. And you said no allergies?
No allergies at all.
And do you have any chronic issues or pain?
No.
Okay. And then for your past medical history, have you had any illnesses?
I've had the flu.
Okay, and then no allergies. Have you ever been hospitalized before?
No.
Okay, and then have you had any past surgeries?
No.
Okay, are you a tobacco user?
No.
Okay.
I sometimes use it if we're out drinking, but I don't buy cigarettes.
Okay, and then how often do you drink alcohol?
I drink frequently, so maybe like one drink a day, more often on the weekends
Okay.
than the weekdays.
Okay, and then are you a recreational drug user?
No.
So, you said that you were on no current medications. And then do you have a family history of illnesses, cancers?
So in the family on my mom's side, I have higher blood pressure. I think almost all of them have it. Her brothers and sisters have it, and her dad had it. And her dad also passed from a heart attack, so I know there's complications with the heart throughout the family. My mom hasn't had anything like that yet, but from her dad there was stuff. And then my mom also had skin cancer,
Okay.
but it didn't spread to the lymph nodes or anything like that. And it wasn't the melanoma.
Okay, and for your functional ability, are you able to dress yourself?
Yeah.
Okay, and you need no assisted devices such as like a wheelchair or a walker or anything?
No.
Okay, and do you have any difficulty bathing or using the restroom?
No.
Okay, what about getting up and downstairs?
No.
Okay, and how many days a week do you exercise?
About 2.
Okay, and what is your diet like?
I mean, it could be better. I'm eating fast food occasionally. I try to eat healthy when I can, eating vegetables, fruits in the morning. And then I try to cut out carbs. Not like altogether, but I try not to eat as many as those.
Okay. And then how many steps are in your home?
About 15.
Okay. And do you feel safe at home?
Yes.
And then for a support person, like a person close to you, who would you consider?
My brother. I normally tell him things. I have a lot of people I can tell things to, so I have a bigger support system.
Okay. And then have you ever considered suicide?
No.
Okay. And are you considering it now?
No.
Have you ever attempted to harm yourself?
No.
Okay. Are you experiencing any symptoms that cannot be attributed to a physical disease process?
No.
Okay. And do you find yourself losing interest in hobbies and things that you normally enjoy?
No.
Okay. And then for your reproductive system, what was the date of your last menses?
November 23rd.
Okay. And have you ever been pregnant before?
No.
Okay. And then could you be pregnant now?
No.
Okay. So in front of you, there's just a list. It's a review of your systems and the different systems that are in your body. So the first one is neurological, which is brain. Is there anything on that list that you have?
Headaches and migraines. Normally the headaches will turn into migraines. And my brother and my mom also get these as well.
And then what about your cardiovascular system, which is like your heart?
Just the higher blood pressure. Sometimes at the doctor it'll be high.
Okay.
They'll test it again and then it will be like normal. So it kind of like fluctuates.
Okay.
So they've never really said anything about it.
Okay. And then what about your lungs and your breathing?
For the shortness of breath, I used to go to school like in West Virginia, so walking up the mountains, I would get shortness of breath. I don't know if that's normal or not, but
Okay. It could be just from you going up the mountains.
yeah, it doesn't happen like now so much anymore, but
Okay, and then what about your GI system, which is like your abdominal area and like elimination?
no problems really with that ever.
Okay, and then your integumentary system, so like your skin.
No, nothing, no rashes or anything like that or bruising.
Okay,
That is like unexplained.
okay. So what about your musculoskeletal system and how you get around?
No,
None of that.
I have some pain in my thumb, but that's when like I fell on it and it bent, so
Okay.
I don't know if that's needs to be looked at or not, but that was like months ago.
And then for your endocrine system, which is like your hormones and stuff like that.
No problems with that.
Okay. So to your ankle, so how did it happen?
So I was just walking at work and I think I just like accidentally tripped over myself and twisted it and fell.
Okay, and when did this happen?
That was about 2 days ago.
Okay, and which ankle is it?
The right one.
And what kind of symptoms are you having? So your ankle is
So you can see
swollen.
it's like, pretty swollen. It's red. It's starting to bruise down where like I think I fell on it.
Okay.
Obviously it hurts. Just like when I move it around, when I walk on it, it hurts.
Okay, so for aggravating and alleviating factors, what are things that you do that makes it feel better?
So the past 2 days I've been trying to do like elevation, ice. I've been trying to rest it as much as I can. I have been walking on it, but the ice and elevation really helps it. Especially like the pain, the ice helps kind of numb.
Okay, and then for aggravating, which makes it worse, is there anything that you can think of that you do that specifically makes it worse?
Definitely walking on it. If I move it in like certain directions, it'll hurt. Especially the way like I bent it when I fell. That it hurts the most that way.
Yeah. Okay.
And it's more so on the top of the ankle than anything else.
Okay.
Like, and it goes down through the foot.
And have you done anything to try to treat it besides coming in here today?
I've just tried to use crutches when I can just to keep myself off of it because like I said, it does hurt when I walk on it or put weight on it, so
Right.
I've been trying not to, but it's still hurting. I
Okay.
don't know if it's normal to hurt in the past 2 days, but I just thought it should be looked at.
Okay, and then for the severity of symptoms, so for that we do a pain scale, and what would you, from 0 to 10, what would you say your pain is?
It's like a 6 if I'm like icing it and putting it up and I have it wrapped, but 7 if I'm walking on it, maybe even 8.
Okay. It looks like we have everything done, so I will go get the doctor and tell him all of this, and he will be right in.
Okay, thank you so much.
Thank you.